Okay, so my topic that I chose is emergency medical care and triage. So, emergency managers, the community, individuals, and any other groups are important when it comes to emergency medical care and triage. Emergency managers have to make really fast decisions under pressure. They need to coordinate with healthcare providers like hospitals during emergencies. They also can help educate the public about emergency medical care and triage. They assure resource allocation during triage, so they'll basically just make sure that resources are being used for the most important and urgent needs at that time. Communities, groups, and individuals can help by learning basic emergency care, so things like opening up the airway, controlling bleeds, treating burns, just kind of the basic first aid. It's also important that they at least understand how the triage system works because that will help the process go by a lot faster and in a more accurate fashion. So, some issues and challenges when it comes to emergency medical care and triage. There may be resource limitations, so things like shortages of medical staff, equipment, or supplies needed for medical care, or triage or treatment. So, there also might be mass casualty accidents, which are obviously stressful. They can quickly overwhelm the healthcare systems and responders, so it's going to be chaos. Everybody's going to be stressed out. This is why triage is so important when it comes to these mass casualties because it kind of creates a system for them. And then communication and coordination is also super important, and just making sure that there's communication between the responders, hospitals, emergency managers, and the community. So, preparing and planning for emergency medical care and triage is super important because there can be ethical and legal issues. It's important to make sure that there are guidelines and policies in place. So, when it comes time to make important decisions, maybe it's about resource allocation because maybe there's a short supply of medical resources or care. It's important to, have those things, those guidelines set in place. Preparing for resource management is important, and making sure that we have medical resources and equipment available, including medical supplies, medication, PPE. So, PPE would be things like gloves, masks, or goggles, and then trauma kits. And then education and training is important when it comes to preparing. It would be good to have training sessions for responders, healthcare providers, and volunteers, just so that they're up to date on everything. We should also make sure that the community and the public are educated as well. Triage protocols should be developed and maintained so that we can ensure responders understand the different categories and how it works. We should also educate the public about CERT or Community Emergency Response Teams, and also just about basic first aid and CPR so that when an emergency happens, they feel somewhat prepared. And then lastly, just some recommendations for future improvement. So I would say to focus on continuous improvement and making sure that we are implementing the best practices. Investing in training is also super important. So maybe things like increasing funding and resources for training and education for responders, healthcare providers, and community volunteers. Research and evaluation is another recommendation. I think that research initiatives should be taken to assess and understand the effectiveness of current efforts. Any important findings from this research should be used so that we can develop better practices and improve the system. And that's the end.